everyone, it's lovely to be here with you all again to deliver another health education workshop as part of the Prime Time of Life programme. The focus of today's workshop is arthritis and joint health. So as this is a quick 15-minute workshop, please be mindful that this is only a really quick overview of the topic, but I've tried to include as much information as I can. So what is arthritis? So it's a term given to a group of more than 100 conditions that involve pain, stiffness and swelling in the joints of the body. It is the leading cause of pain, impaired functionality and disability. And the limitations associated with arthritis can interfere with our ability to perform routines of daily living, such as holding a cup of tea, lifting our shopping bags, or walking to the car and things like that. And it also contributes to physical inactivity and high levels of sedentary time. So a lot of time in a sitting, reclining or lying position, which in turn can contribute to increased cardiovascular and metabolic risk. So that increased presence of chronic diseases. Because this is only a quick overview, I've chosen to focus on two main forms of arthritis, which is our osteoarthritis and our rheumatoid arthritis. So we're kicking off with osteoarthritis first, and it's described as a local degenerative joint disease, and it usually develops over several years, and it affects many different joints, particularly the knees, the hips, the hands and the spine. And the pain can vary in severity. So for some people, the changes are really subtle and it'll develop over a long period of time. So it might be hardly noticeable. However, others may experience gradual worsening problems, including pain and restricted movement, particularly in the large joints, such as the hips and the knees. So the mobility and quality of life is impaired. So that can have an extreme impact. Now, you can also get osteoarthritis in the fingers, thumbs and wrists. I just said above the hands, but this can actually affect our ability to open jars or pick small things up and do your buttons on your shirt, for example. So it can have a huge impact on your daily life. And in Ireland, approximately 400,000 people are affected by osteoarthritis. So just to put some facts and numbers in there. So what actually happens in osteoarthritis? So highlighted in the green box here is a normal joint, and then we have what I call number B and C. So B in the middle and C to the right shows the worsening of osteoarthritis. So osteoarthritis is a disease of the whole joint and it's not just the cartilage. So highlighted in pink is the cartilage, okay, and this provides a protective layer that covers the end of the bones. So it's very smooth, strong, flexible, and it ultimately absorbs the stresses put on the joint and allows for that unrestricted movement. However, in osteoarthritis that you can see in pictures B and C, it becomes pitted, brittle and thin, and over time it can wear away completely. And when this cartilage deteriorates, the bones underneath can thicken and broaden out. So you can see that more so in the third picture. And this can actually cause bones to rub on bones, which will cause pain. So really not what we want. In addition to this, so the joint or synovial fluid, which you'll see in the pale pink, which functions as a lubricant and carrier of nutrients, can deteriorate in quality with worsening of osteoarthritis. The joint lining or synovial membrane, which we can see in the dark grey, can actually make the joint fluid become inflamed and swollen. So these processes together with the thinning cartilage can affect the smooth movement of the joint and contribute to the pain, the stiffness and the swelling. What also happens in osteoarthritis is bony spurs can develop around the joint, which can cause the change in shape of the joint, and it might appear like knobbly, as it's usually referred to. And you can see there as well on the third picture more so that's the worst state of osteoarthritis, the joint capsule will also become thicker, so the lighter grey, and the amount of synovial fluid will increase, often causing the joint to swell. So you get this stiffness and pain again. So at the same time of all of this happening, the bones and the muscles can become weaker and the muscles become tighter. So it's really not good as it progresses. So there's no single trigger identified to cause osteoarthritis. However, there are some definite risk factors. So osteoarthritis usually develops after 40 years of age, but it is not an inevitable part of aging, okay? As long as you keep up your physical activity and exercise training. In terms of genetics then, or sorry, if I refer back to age, okay, the reason it's related to age actually is through the degeneration of the quality of the cartilage and the joint fluid as we age, also impaired healing as we age, and that sarcopenia and dynapenia, so the loss of muscle mass, strength, power and function. So for example, if you have, if you take the muscle at the top of your leg, your quadriceps, if that becomes weakened, it can contribute to knee osteoarthritis. So back to genetics. So some forms of osteoarthritis can actually run in families, such as nodal osteoarthritis, and that particularly affects the hands of middle-aged women. And there's also some rarer types that can actually occur in younger people, that can be related to genes that affect collagen, which is an essential component of the cartilage. But in common forms of osteoarthritis, hereditary usually plays a small part compared to the other risk factors. In terms of gender then, so osteoarthritis is more common and often more severe in women, and particularly starting after the menopausal transition. In terms of overweight and obesity then, so that's a significant risk factor, particularly in the knee and the hip, but also in the hands. So it's got to do with the chronic excessive loading as part of that with the increased weight. The next one then is physical inactivity or chronic insufficient loading. Okay, so the lack of loading on our muscles and our bones, and that's detrimental to joint function and also joint nutrition. So getting that synovial fluid to the joint as well. Certain occupations as well can increase the risk of osteoarthritis, so especially those that have repetitive knee bending, okay, so that can bring on osteoarthritis in the knee, and also those that manual labour can often bring on hip osteoarthritis. And finally then, joint injury or misalignment. So any major injury or surgery in one of the joints can predispose osteoarthritis in later life, and also if there's any misalignment in your bones. So for example, if your knees are more inward facing or outward facing, that can cause it as well. So the second form is rheumatoid arthritis, and it's the most common form of autoimmune inflammatory arthritis. So an autoimmune condition means that your immune system, your body's natural self-defense system, is actually confused and attacking itself. Okay, and in rheumatoid arthritis, the main thing it does is causes inflammation within the joints. And this condition can vary a lot between person and person. It can affect almost any joint, but particularly the fingers, the thumbs, the wrist, the feet, and the ankles. The knees and the shoulders can be affected, but less commonly the elbows, hips, neck, and other joints. It actually, most people are affected in more than one joint as well, and it usually affects both sides of the body. So this is not always at the same time, but can actually happen within a short space of time. So important to notice it. And just to give stats again on this condition, so 38.6 per 100,000 of the Irish population in 2019 had rheumatoid arthritis as well. So in this condition, okay, your immune system aggressively targets your joints and they become inflamed. So the inflammation particularly affects the synovial membrane, so the thin layer of tissue lying inside the joint, the tendon sheets, which are the tubes in which our tendons move, and the bursa, so the little sacs filled with fluid that coat the joint to help it move easily. And what happens then is the joint swells and the inflamed tissues become stiff, painful and swollen. And if the inflammation isn't tackled, the joints can become damaged. Okay, and much of this happens in the first few months and years of having the condition, so it's really important to notice the symptoms and signs of this. The triggering factors of rheumatoid arthritis are not yet known. However, it is thought that risk factors include age and gender. So again, as you get older and more prevalence in the females, stress, an infection or virus, smoking. So smoking is an environmental factor and it significantly increases the risk of rheumatoid arthritis, as well as it can weaken the medication for this as well, and also having the presence of certain genes. At the present, there is no cure for rheumatoid arthritis, but the right treatment is so important. So what is the treatment? So optimal treatment of arthritis features a multidisciplinary approach. So there's some things that you can do and there's some things that you can get help from others from. So these include lifestyle management, which weight loss may be appropriate, good nutrition, and exercise. So we're going to focus on the exercise guidelines for arthritis in the next few slides. In terms of occupational therapy then, so you may need help to figure out how to do the things in everyday life that you need to do with ease. An occupational therapist can really help you with this, and you can get a GP referral for occupational therapy as well. In terms of medication, you may be on one or more medications for arthritis, but again, your GP will be working closely with you, so please seek medical advice if you need it. And just to note that in severe joint damage and where somebody has the loss of mobility, total joint replacement may be required. So just to make you aware of that. So what are the benefits of engaging in physical activity and exercise for people with arthritis? So it increases muscle strength and function. So this will help take the pressure off the joints, and it's achieved mainly through resistance training. Okay, so not aerobic exercise such as walking. You need to put an external load onto the muscle, and we'll speak about the recommendations in a few minutes. Increase flexibility and range of motion. Again, if you do that type of training, can help reduce joint pain and stiffness. An increase in aerobic fitness if you incorporate your aerobic training, thereby minimizing your functional decline. It allows for a decrease in comorbidities, so helping to control weight, so reducing overweight and obesity, and also decreasing the incidence and risk factors of cardiovascular disease, type 2 diabetes, metabolic syndrome, and osteoporosis, just to name a few, and ultimately increase your mental health and your quality of life. So what type of exercise? Okay, so briefly mentioned them there, but again, it's multimodal training. So our aerobic, our resistance, our balance and flexibility training is recommended, with a particular focus on flexibility and resistance training. So when I refer to flexibility training, I'm talking about stretching. And when I refer to range of motion, I'm talking about moving your joints through the full range of motion. So, you know, at the start of your prime time of life exercise classes, and the instructors will get you to move your wrists up, down, and all around. You are moving that in its full range of motion. And we do that with the elbows, we do that with the shoulders, we do that with the knees and the ankles. And it's so important to incorporate in a warm-up, but to incorporate as much as possible in your daily lives. So the frequency for these are 7 days per week. The intensity is always as tolerated. So you should never ever feel pain in your muscles, only tension. So say, for example, if you are performing the stretch that Anne is doing there in the slide, so she is stretching her groin. If you find that you're in pain doing that, you need to reduce you need to reduce how far you go down, and you need to stand back up, thereby putting less pressure on it and causing less pain. So just be mindful that if you need to pull back, please pull back and don't be in pain. In terms of time then, so static, so that's holding stretches still, so no movement, 3 to 5 repetitions, and a hold for 10 to 30 seconds. In terms of dynamic then, so our dynamic is a gradual transition from one body position to another, with an increase in reach and range of motion. So for example, our arm circles or our high knees, so lifting up your knees to get the hamstrings working, or your foot circles or ankle circles. Up to 10 repetitions, hold for 3 to 5 seconds. And ultimately, a combination of dynamic and static stretching on all major muscle groups. So important. The second type then that's so important is the resistance training. So frequency for this is 2 to 3 days per week. Intensity, so initial intensity should be light and progress to moderate. So if it's light, it's something you can do about 15 to 20 times. If it's moderate, it's something you can usually do 10 to 15 times. The time then would be 2 to 4 sets of 8 to 12 reps. So if you did 8 reps first, you repeat that 2 to 4 times. And the type would be a focus again on all major muscle groups in the body. And for this, you can use body weight, free weights, or machine weights. So you'll see there in the top picture, Anne is doing a press up with her body weight, and below she is doing a lunge with free weights. So often the intensity or the loading that you can provide in resistance training will depend on your status of arthritis. So please be aware of this. All recommendations will be individualized. In terms of if you have severe osteoarthritis or rheumatoid arthritis, you may need a very tailored program. So obviously with prime time, everybody is screened by the exercise physiologist, and it's a whole program approach, okay? But sometimes you might need that one-on-one information. So please get that from an exercise physiologist if you need it. In terms of aerobic training then, so aerobic training we know is so important, particularly for your heart health and reducing cardiometabolic risk. But just it is so important still, but don't do it at the expense of the other two types we've just gone through. But ultimately, you want to be doing aerobic training up to 5 to 7 days per week at an intensity that is moderate. So always remember our talk test. There is no need to be working too hard for this, but just at low to moderate if you can. Again, start with 5 to 10 minute bouts and progress to 60 minutes over time. So you might need to do that in 2-minute bouts. You might need to do that in 20-minute bouts, whatever works for you. But please be mindful of the progression and that it's right for you as well. In terms of type then, so it's activities with low joint stress. So walking, cycling and water exercises. And water exercises are actually really good for people with arthritis because your body weight is supported. So it's actually going to be less difficult. So if you have arthritis and you've never tried it, please have a go. And just to note some special exercise considerations for people with arthritis. Please avoid any strenuous exercises during acute flare-ups and periods of inflammation. So you will know exactly when these are. So please pull back your training during this time. However, during this time, it is appropriate to gently move your joints through their range of motion. So again, remember our wrist circles. And adequate warm-up and cool-down periods are critical. So in all our prime time of life sessions, we will always make sure there is a 15-minute gradual warm-up and a 5 to 10-minute gradual cool-down. So this is so important, and please never skip this phase. And that is for everybody, not just people with arthritis. If you would like to progress your training, we would recommend increasing the duration rather than the intensity. So please increase the time that you are exercising instead of adding more difficulty first. In terms of joint discomfort then, okay, so a small amount of discomfort in the muscles and the joints during or after training, immediately after, is common, okay? Most people experience it, but if your pain is persistent for more than 2 hours, reduce the duration and the intensity of the exercise or you will cause further damage, okay? You don't want an adverse event, so please take it easy every time. And then exercise at the time of day when your pain is least severe. So you again will know exactly when that is. So please try and do that as much as possible. Try to wear appropriate footwear, particularly that has good shock absorption and stability. And incorporate functional activities throughout the day. So Anne here is demonstrating the sit to stand movement, which I know you've all done in your prime time classes. So challenge yourself. You know, while you put your toast in the toaster in the morning, how many sit-to-stands can you do? When you're boiling the kettle, how many sit-and stands can you do? So try and get them in multiple times during the day. And finally then, just for this workshop, we have created a sample exercise routine and a sample 7-day training diary for you all to use, but particularly if you have arthritis. So we really hope this will be of great benefit to you. And if you have any questions, please let us know. But thank you very much for listening to this presentation. I'm sorry it was a quick run through, but hopefully we will see you again very soon. Thanks a million.